I have with me, so I'm really excited about this. You all now will know what Victoria sounds like, which is kind of interesting.
Yep.
But Commander Victoria is a moderator of my channel, which is, I'm honored to have her be a moderator, both of the channel and of the Discord. She's wonderful. She works very hard in that capacity, which seriously, I don't think I've ever told you directly. I really appreciate. But also, it's obvious. Okay, she can see the chat. You guys are welcome to ask questions in the chat. Ping either me or Victoria, but I would say I have some questions I want to go through from the Discord before we get into those. So we'll kind of have a conversation about it. So Victoria has a master's degree in social work from the University of Denver. She has worked in Colorado. That's how much I'll say about that. We're not going to, please don't ask her specifically where she works. We're going to keep that on the DL. But I have actually seen her master's degree, so I know she's got one. So she is legit. So
It's real.
it's like you're like that's like one of the first pictures of you were ever sent me was you with your hands taking a picture of your degree, which is really cool. I'm really excited to have her here. Her and I have a shared experience in terms of working in crisis intervention, but she is a social worker. I am a licensed marriage and family therapist, and those are two distinct fields. So if you didn't know that, you already learned something. But Victoria, do you want to say anything about like yourself or anything that you want people to know about you before we kind of get into the whole like interview thing and start chatting about stuff?
To
put you on the
for
spot.
people who don't know, obviously Victoria, I worked at the local Colorado branch, I guess, I don't know, for the National Suicide Prevention Lifeline for about 3 months after I graduated from grad school. And now I have been working since March my title is therapist, as a therapist at an acute inpatient psychiatric hospital.
And so for those who don't know what that is, can you say a little bit about what an acute inpatient psychiatric hospital does and like what it's there for?
Yeah, our whole hospital has a few different programs, but the program I specifically am in is for people who, whether they call 911 on themselves, for whatever reason, they're there on a 72-hour hold. The 3-4 reasons that someone can be admitted are for suicidal ideation or attempts, homicidal ideation, not so much attempts. Those usually go to the state hospital.
Okay.
Because that's too much for
intense.
us.
Yeah.
We're a private hospital, so they try not to send those there if at all possible. Also, like mania, so people who have bipolar 1, and also just psychosis. So that was usually we'll see schizophrenia, schizoaffective disorder, two most common, or whatever disorder with manic features, and they will stay there from anywhere from 72 hours to I've seen some people be there a couple months.
Okay.
At most. That's usually a really weird situation when they stay there that long, but the point is supposed to be like short-term stabilization to where the person is safe enough or well enough to go to a lower level of care, which can be returning to home, going to outpatient therapy, or going might step someone down to we call them a crisis stabilization unit or acute treatment unit, which is similar, but it's not like, it's hard to describe, but it's like in a smaller environment and it's less restrictive, and yeah.
Cool. And what is your specific role within all of that? Like, what do you do as a social worker within that? If you have one, I know you probably wear a lot of hats because that's kind of how it works. Yeah. But
as hired, my main role is a PRN therapist, and PRN in Latin means pro re nata, which is as needed. So I am essentially part-time. I work every week. Different units, different everything. Really, my main unit that I'm on is helping out with the groups and assessments on the highest acuity unit, which that's mostly psychosis and mania. Otherwise, I'm pretty much only on the acute side. I don't do anything with, like, we have a residential program, which is like for teenagers and kids. I don't do that. And we also have a partial hospitalization program, which is like just 8 to 2-ish, where you come every day for like just 5 hours straight of group therapy.
And they do that in lieu of going to school, I imagine. It's usually how PHP.
Well, that's for adults.
Oh, okay.
So,
all right. So.
I mean, they do have a kids PHP actually. Just kidding. So yeah, that would be in lieu of school.
Okay.
And we actually have a school that kids can go to like make sure they don't fall behind on credits and stuff.
Okay. And
so.
Oh, go on.
Today, sorry. Usually I'm doing groups, which is just an hour of like process groups. So it's like therapy. Depending on which group I'm in, it sometimes is or is not very productive. Like when everyone is completely floridly psychotic, you don't really do a whole lot. But
sure. I can imagine that gets quite chaotic.
A little bit. It's kind of like herding cats a little bit sometimes. And I say that with all the affection in the world. I love that, you know. Or what I've been doing this past week, I've been the main unit therapist, which is every unit has its own therapist. Like, it has a psychiatrist, a therapist, and there's like a utilization review person who, you know, gets on their knees and sucks for insurance to get them to pay for their stays.
Okay.
So I'm taking over that role because that person stepped out, went part-time. And so that is a lot more, less therapist, more social work case management stuff. So discharge planning, like when we get out of here, where are you going? Can you go back home? Are we going to send you to a shelter? Scheduling appointments for aftercare, usually with the local mental health center. Creating a safety plan, doing a whole psychosocial assessment, which is like 8 pages of literally everything from how old are you to what are your parents' names to like addictions and where you went to, not where you went to school, but how long have you gone to school or what, like literally everything, because we're trying to get the best picture of all aspects of that person instead of just what's wrong with you. And you know, coordinating with the other team members. And so I've been doing that, and it's been, if you've been in Discord, you've seen it's been a little bit rough, but today was good. So.
Sure.
Yeah. I'm done talking and ranting now.
Oh, that's fine. It's good for people to kind of know the context that you work in.
Just in case.
Well, do you want to answer those before I ask you specific questions from the Discord? Because you're welcome to do that. Like, is that a 5-hour session or 5 hours of various groups?
The first one's pretty easy. It is 5 hours of various groups, so it's like 1 hour of one thing, and then, well, it's 50 minutes, and then a 10-minute break, and then 50 minutes and a 10-minute break, and 50 minutes and a 10-minute break, and depending on like what track you're on, whether it's for like depression, anxiety, trauma, substance use, you will have different things that you do in those. And the
interviews channel,
rules about
bloody,
72 hours, I think we could do that one later because it'll probably fall in somewhere else.
Sure. Yeah, the interviews channel, bloody, is where you can ask the questions. All right, so I actually want to ask you before I ask the first question, because I think it's an important one, is can you just share briefly with everybody what a social worker is? Like, what does it mean? What does it mean to be a social worker? Like, kind of why did you pick social work versus maybe other mental health fields? That kind of thing, just because I think that's a really important thing for everybody to know.
Yeah. So social worker is, and pretty much I think all 50 states, a quote-unquote protected title, meaning it's like you can't just call yourself a lawyer, you can't just call yourself a medical doctor. Like, means like you have in law have to have a certain education. And so it's not like some people kind of, you'll see on Twitter, I'm a social worker, but they're really not. Anyway, that's a whole thing on its own. What we
right. Yeah, we probably don't even need to go there.
Yeah, the National Association of Social Workers, they kind of run the show essentially in terms of advocacy and lawmaking and setting standards and all that. They push really, really, really hard in a lot of states to get that done.
They are quite active in terms of lobbying.
They are.
Like
they're expensive.
They really are. I mean, in relative to like other mental health fields, they are quite.
Thank you, Cindy.
They are quite involved with litigation and stuff. It's pretty, or not litigation. What am I trying to say? Legislature.
Yes.
Pretty cool.
Yes.
And the envy of many other mental health fields.
Yeah. One thing I know that has kind of come up is that part of I'll start by saying what social work is by kind of saying some of the differences in a way.
Mm-hmm.
In terms of, because the NASW is such a strong lobbying force, every reason, federally and in state levels, they tend to, like insurers, state insurers, like so for Medicaid, Medicare, they tend to quote unquote respect social work, like licensed clinical social workers, more than a licensed professional counselor or an LMFT, which is stupid. Like, in a sense, we're really all equal, but that's why, like, when I asked, oh, do you take Medicaid? And you're like, no, it's a pain in the ass. Well, for licensed clinical social workers, it's pretty easy because they're like the one people to reimburse.
Yep.
So that's one thing. And it literally shows the power of lobbying because that's the only reason it's such a big difference.
Yep, which is why I say they're the envy of other fields, because it's really a pain in the ass if I want to bill Medicaid or even Medicare to some extent as an LMFT. Really a big pain in the ass. Social workers get a lot more love from insurance than LMFTs do, or even LPCs.
Yeah, and it's honestly, I joined NASW while I was a student. It was really cheap, and now as an adult, quote unquote, I haven't renewed because it is really expensive, and I feel like they do too much lobbying in that respect versus actually lobbying for clients. But
hey,
so
that's fair.
what social workers do, it started out, with essentially a rich white woman looked at people and saw, like, in New York City, for example, all of these poor people, and it's like, how do we write this? This is wrong. And so she used her poll to, like, get there to be trash pickup every day so there wasn't trash in the street. And it's kind of evolved from there to where I'm sure everyone knows, you think of a social worker as like, take your babies,
Right.
That is one thing that social workers do. They work in, yes, I'm a garbage woman. Yes, I'm a garbage woman, thank you. Kind of am in a way, but yeah, her name was Jane Addams. I am a bad social worker for not knowing that, but she's like the mother of social work, essentially.
Joseph Smith of social workers.
Yeah, essentially. But now, what social workers are seeing is kind of like you work in child welfare, child protection services. And yeah, we do that. That is certainly, child protection services does look to hire social workers, but that's largely because of social work. What's really kind of two things, I guess, that I would say are defining about social work versus other mental health fields is, like I said the other day, the social justice focus on it. Like, where we really try to focus on people who are marginalized and deal with oppression. Versus, just kind of whoever, whatever. Not that we don't, like, deal with people who have money and all, but that's not really supposed to be our focus. And also, the core of what social work is the person and environment perspective, which kind of sounds, I think that's kind of self-explanatory, but we look at the person as someone who's interacting with their environment, which can include the family, but it also includes, like, on a micro level, like their family, their coworkers, their, any other groups they're involved in, this Twitch channel maybe, to your communities, to on the macro level, like really, like nationwide, what are norms and like institutionalized oppression, all these things. So it looks at all of those different things to say, okay, now also internally, like what's going on in the person internally a little bit, and trying to take all that into account to see why is this person reacting in this way.
What's your favorite part about being a social worker?
I think my favorite part is that I actually really like the job. Kind of part of what I got into social work for, because you asked me that. like in college, I always wanted to do something. Thanks, buddy. I always wanted to do something with therapy. Like I wanted to be a psychology major, but I was already an international studies major, so it really, the two degrees didn't fit real together, because international studies was do whatever you want versus psychology is like you take class A and B and C and D, and so I was like, okay, fine, whatever. And then I graduated and I ended up working for insurance. I worked.
Oh, you actually? Oh, that's right. You did work in insurance.
Yeah, it's a big part of where I'm at now. Actually, is I worked for United Healthcare, specifically with when they had the TRICARE contract for the two-thirds of the United States. And TRICARE, for people who don't know, is insurance for active duty and retired military and their family. And so I realized just from working in it that I always wanted to do more for people that I was talking to, because I was very limited. Like, you can only do this thing. Can't talk for longer than this long. It's like, well, I want to call this provider for them and get this referral fixed, but I can't. And,
right.
I remember one day they had something pop up on our website that was like, get a social worker. And I was like, oh, what's that? And I looked into it and it was like, dude, that's what I want to do. And I just kind of followed it and only applied to the one grad school, even though I considered others.
By the way, UDenver is a really excellent social work school. Like, that's not a...
It is.
It's not a...
Yeah, it is.
Nothing to sneeze at. That's a really great school.
And it's really, really expensive.
Yes, it is.
I'm in debt forever. But I went there, I got in, and like, I cried when I got the acceptance letter. So I was like, I can get out of this. I hated the call center. I could get out of this, and I can do something I love. And I've always been like the person that people just talk to about stuff. And I'm just like, okay, cool, yeah. And if some friends like in high school or middle school are having a rough time or thinking of suicide, they would call me and like just talk to me, even if I didn't know how to deal with it.
Yeah.
Like,
been there.
So yeah, that thing that I think a lot of therapists, if not all of them, deal
Yep.
with. Like, oh, I was the person people talk to.
And I don't even know why. So many therapists like say that. Like, I don't even know why. Why did people do that? Yep.
I don't know, but I guess I'm a good listener. So, yeah, that's what I love about it, is that actually, like, even as stressful as it can be, I do enjoy my job, and the day goes by so fast versus compared to other jobs I've had. It's like literally counting the minutes until I can go on to break.
Yeah, sure.
Now I'm like counting the minutes like, oh crap, I can't go over 8 hours because I do work for like, it's not a nonprofit. Like a lot of social workers tend to work in nonprofits.
Right.
So this is a for-profit company, so they are really strict on helping.
Yep.
Like especially because the full-time therapists are salaried, so they work however much. The PRN therapists like me, it's like you can only work so many hours because we only have so many patients. So that's really kind of frustrating.
If we have you around more, we have to pay your benefits.
Right, and that's also why I try not to work.
Yep.
I could work 40 hours if I really wanted to, but I'm like, I'm not working 40 hours. I'm not getting benefits. Like,
yeah,
no.
I can't say I blame you. Yeah. What has been the most difficult and most rewarding experiences on the job for you?
The most difficult thing I've dealt with has definitely been when I was doing, kind of leading to that, when I've been doing the crisis line. Part of it, like hearing the things that people, like the things they would say was fine, but when someone called in and I wasn't used to it, someone calling in, oh my God, I'm going to kill someone. And I'm like, dude, what? No, hello, thank you, or anything. Just walk right with that. It's like, what is going on?
Yep.
Hello. So trying to deal with that. And then,
do you ever have it? Like, I remember when I was working on the crisis line, that there would be times where people would call and just like literally drop that as like the first thing that they would say. Is they would be like, hey, I'm and sometimes it would be a prank caller and you could tell, and sometimes it was like it was legitimate and it was like an actual homicidal ideation, and all of a sudden you are working with somebody who's intensely angry and is experiencing homicidal ideation, and all of a sudden you're the person on the other end of the phone that you have to that has to answer that, and that's like really intense. I mean, I remember like there'd be calls where it was a slow build up, and then there were calls where it was like boom in your face. Did you, like what was that like for you? I know it was always like really odd for me.
It was especially difficult at times for me. Like if it was a call I was used to, like, oh, I have, like, I just want to, fucking die, blah blah blah. I was like, whatever, that's fine. But like, it was whenever like something was like more high stakes, like no matter how you explored it with the person, they didn't see hope in anything. It like nothing stuck, and it was just like, okay, well, can we try to come up with a plan for like the next hour? And they're like, no, and like you couldn't get anywhere, and so and then like you said earlier, where they just kind of hang up, and you're like, well, fuck, do I call them back?
Right.
Or do I not call them back because I feel like I should, but then I shouldn't, and that was like, if someone called so many times and hung up, we would call them back no matter what, but that was like, shit, schedule a follow-up to where, another clinician would call back and try to check in on them, but then this particular one, like the phone number didn't work.
Yep.
So that, because they like use Google
like
Voice or something.
Or that, or like a burner phone or something. Yeah.
Yeah, so it was like, great, this person was feeling pretty horrible and they were pretty hopeless, and I rated them like, we had a totally different rating system than you guys. Well, not totally
you didn't
different,
have the 1
but
to 5?
no, it was like on a scale of 1 to 10, and then there were like the subsections for like intent, whatever all 4 of them were. I don't even remember.
We ended up actually doing, I don't know if you did this, but we had where if a person called that was anywhere between a level 2 to 5 suicide call, we actually would do follow-up calls the next day. Like that became part of our protocol, and so we would actually, so I did overnight shifts, and I'd go off shift, and I would sometimes have to leave a note for the person who was going to be there from like 4 to 8 of like, hey, you need to do a suicide follow-up call from 4 to 8. I know that sometimes would cause anxiety for the person who was going to be on from 4 to 8, because they would be like, oh God, like I have a potential suicide call like up front here. Yeah. Like what happens if I call and they're still feeling that way? But what was interesting is that actually we saw a reduction in repeat calls by doing that. And so did you guys do any of that like at all in your experience?
We did, but a lot of things, I know why they did it the way they did, but I wish there would have been more, maybe it's my learning style, like more if A then B sort of like procedural things, because it was more like it's kind of up to you. So sometimes, like, yeah, if the person was certainly really, really high risk, like I think we considered high risk to be a 7 or to a 10. I don't think I ever rated someone a 10. We would give them a call up the next day, be like, hey, how you doing? You okay? Like, do you need extra resources? Blah, blah, blah.
Right.
But if someone needed us to call back in an hour, we would do that, or after work, we would do that. But it wasn't like a standard thing of, if someone's super, super high risk, then we're not gonna, like, you have to call them. It was just like, you probably really should. Yeah, they say, like, can we call you back? What time? What number? Can we leave a message? If we can't leave a message, can we even say who we are?
Right, right. You have to do your due diligence around that. Yeah. What do people not know about social work, or what's a way in which social work is misrepresented?
The whole baby snatcher thing. Like, that drives me nuts, and sometimes reminds me of, I was getting my hair cut once, and this person's like, hey, what do you do? And I said, I'm a social worker, and I was like, oh God, why did I say that? She's gonna mess my hair up. Like, God, no. No.
True. By the way, CPS, it takes I want to make this a very clear point for everybody. It takes a lot for DCFS or CPS to take children out of the home. That constitutes a trauma for the family and for the child, and so there needs to be a lot going on in order for them to yank a kid out of the house. And so the way that gets represented a lot of times in popular media and what people talk about, what they're afraid of, starts to become a reality. And like, if people have their kids snatched, it's because there's way more going on than they're letting you know. Because it's really hard to remove children from their homes, like really, really hard.
Yeah,
So.
like, for sure. It's kind of with child welfare specifically, it is a little bit of a pendulum, and you're never going to get it right between like, keeping kids together with their families, because that is so very, very important. And it is such a trauma, even if, the parent is just beats them, abuses them in any way possible, they still love them because that's their caregiver. And, even if they have all these complex feelings. So taking them out is still hard. And when they do that, they still try to place them with family if at all possible. But like, if they take them from the kid, then, you're bad because you took the kids. But then if you leave the kid and they die or they get really screwed up, then you're bad that way. So it's kind of swinging between don't leave them with the bad parents versus don't take the kids away. How dare you? So it's constantly back and forth and back and forth and back and forth between that. Like, and I remember we read a specific article about it with, I don't know, somewhere, one of those horrible stories that I won't get into because I don't want to even talk about it, but where there's a really, really horrible outcome. And of course, public outrage is like, how fucking dare you? Like, what is wrong? And then they look into it, and the caseworker had like 90 people on their caseload, or not even kidding, 80, 90 people they're trying to deal with when it should be like 20.
Yep.
And even that's a lot. And it all gets put on the caseworker, and then they're like, oh, we need to do that more. And they try to take the kids out more, but you're taking families apart. How dare you? And you never make people happy there.
Well, they also, like, the thing is you never get the full story. You don't ever have the full complexity of that. Like, it's something that I've always found as a therapist, and I can only imagine that it's got to be more for social workers, because you guys are more likely to go into people's homes and really be in their context and stuff, is that there is so much that goes on behind the scenes from what is actually put out for other people to consume and know. And sometimes it's really hard as a therapist, and I imagine as a social worker, to know that, and then to see the way that the public responds to certain things when social workers and therapists are involved. That's always something that's been really a struggle for me personally. What do you wish you knew, or that somebody told you before you got into social work?
I know you're talking about like social workers kind of see it because we tend to be the case manager thing. That's honestly part of what people don't know about social work, is that we tend to do that a lot more versus, baby snatching.
Right.
And that's kind of like what I described earlier with coordinating resources, checking in with the person to see what they need. And part of that is usually going to be going to people's homes. So especially with bachelor's level social workers, you can get a bachelor's social work, which is just like your 4-year degree.
Yep.
They tend to do that sort of work more often, whereas the master's level will build on that in essentially the second year and teach like what I did. I have the mental health. So social work, one thing a lot of people don't know is it's a very, very diverse field. Like, you're talking to a social worker who works in mental health right now, where it's like
right.
The different. I'm actually going to pull up like all the different things that my school has, because there's different concentrations. Everyone has to take the same like foundation courses in the MSW program.
Yeah,
anywhere.
You see social workers everywhere. Like, that is amazing. Like, there is so much more versatility in what you are able to do with a social work degree than I think really with any other degree.
There are social workers in libraries now. That's the new thing, I guess, is like putting social workers in libraries, because they tend to attract people who are experiencing homelessness and don't have a lot of resources. So it's like the perfect little, our phrase is like, meet people where they're at. That's literally meeting people where they're at,
Yeah.
Okay, so I'll just go through all the different, because your second year you focus on like your specialization, beyond like the basic human development, clinical skills. So they have aging services and policy, child welfare, which is the child protection essentially, children and youth, family systems practice, which is they have a specific program that actually can get you in Colorado a licensed marriage and family therapist title. Because they'll let social workers get that for some reason. I don't know.
Yeah, there are some states that allow that.
Yeah,
I mean,
ours is one of them.
You get some degree of systems training, so I suppose that makes a bit of sense to me. But
Yeah,
Illinois,
but-
I think, is similar. Though.
Which I'm kind of like bummed out about because like each person does their thing. But family systems practice, health and wellness, which I think that's more just the physical health of it versus mental health. So like eating healthy, access to food resources, things like that. Dental health, which is the most popular, which is also what I did.
You say
That's where
dental.
mental.
Mental. Oh, I was like, okay,
Mental health.
that confused me for a second. I was like, really? Like,
No, dental.
okay.
I mean,
right.
part of the health and wellness may be dental health.
Sure.
Mental health.
Like, okay. All right.
And that's where you learn the quote-unquote therapy stuff. Like, you have to take CBT, and now you have to take actually suicide assessment and intervention. Rather.
So they have a whole class focused on that?
Yes, I took that
That's
class when it was
awesome.
like, I know, when it was an elective, and they switched that out. The next year was CBT, cognitive behavioral therapy,
Yep.
not the other thing, to be a required class.
Right.
So you're taking those classes to learn how to quote-unquote do therapy. Organizational leadership and policy practice, so that is kind of like where you want to work with like nonprofits on like an administrative level,
Yep.
or for-profits and manage things on a macro level that way. And then you also have sustainable development and global practice, which is very much the international social work. Which actually fit more with what I studied in undergrad with international studies. So like, international human rights, Doctors Without Borders is one of my professor with Doctors Without Borders. And also like sustainable development, so organically going to places that need help, saying, what do you need help with if you want help at all? Versus, like, I'm gonna poop on, what is it called, AmeriCorps? No, not the Peace Corps.
Oh, the Peace Corps, yeah.
Whereas they go places and like build crops that no one wants. Or, things like that, where it's like, we're the white people who know better. Trying to actually ask people what they want so they can take care of it and have ownership and address their need versus what someone else thinks.
Right, as opposed to like what somebody who has really none of the same lived experience thinks they need and is completely off base.
Yeah,
It's like the metaphor I always love for that is like it's like the person who thinks that sending candy to people in the military is a good idea when that's like literally the worst thing you can possibly do, and you kind of just like, but you don't know any better because you listen to the person because they have the the credential or whatever it is. But anyway.
And that can also go into like another thing that's kind of growing is like trying to deal with climate change and how do we address that, because that again disproportionately affects people who live in global south / third world countries, the little islands that are going to get flooded and things like that. So that's inherently a social justice issue.
Yep, for sure, which a lot of people don't think about.
I just want to like what Cindy said about they never knew what their mom was walking into. Like, that's one thing that social workers, like, unfortunately, it's sort of expected.
Sure.
Like, oh, well, you're just gonna go into someone's house and you never know what you're gonna find. Are you gonna get attacked by a dog? Is someone gonna shoot you? Like,
you have no idea. Are you gonna work on top of an active meth lab, which was what happened with my
you never know what you're gonna find, and they're recognizing that is in itself not okay. It's an injustice to be like, hey, just do this, deal with it. And trying to stand up for like, okay, no, we should be able to feel safe doing our jobs.
Yep.
So
100%.
I have a lot of respect. One of my people I had in an internship, she works with the child protection here. And I applied for there and I was like, I hope I don't get the job because I can't do it. And that's what's cool about social work, is if you can't do child protection, cool, do something else.
Right. Like the repo men of social work.
Yeah.
If somebody was thinking about entering the field of social work, what would you tell them?
Hell yeah. I would. I just think. I want to say like don't do it, but I would definitely look at yourself and like what I did. Part of it was I went and read the NASW Code of Ethics and read through it, and I was like, am I okay with this?
Good idea. Everybody should always do that if you're going to go into a helping profession. Good on you for doing that.
Yeah, I read it and like, am I okay? Like the things I believe, does this square with this? Can I do this? And it did. So I was like, sweet. You know, just make sure that that's okay, because if you go into the program and like we were talking about last night, mental health tends to be liberal, and you're very, especially in social work, because it focuses so hard on social justice.
Explicitly social justice oriented, yes.
If you come in and you're like, not saying that you can't have certain beliefs and still be a good social worker, because there are people, plenty of people who have quote unquote conservative beliefs, but they put those aside and still help people what they need. But I think it's very difficult. And
it's inherently a political field.
Yes, it is. And
it can't not be. Which
I
think
and
is
it's just like
important to know.
So if you're trying to like adjust social justice, like working with someone who is on Medicaid and all these, you know, government programs, if you're on the side of this American spectrum that thinks that all of that is crap and people don't deserve it, or if people have it then they're drug addicts or whatever, it's going to be kind of hard to.
Well, you're going to inherently be really biased hard against the people you're working with. And that can cause a lot of harm and further institutionally oppress them, because now their mental health worker is also perpetuating a stigma about them.
Yeah, exactly. And we had one thing I really, really liked about my program that I wish others had, because it was so good. One of the first classes you take, even the people who come in with a Bachelor of Social Work have to take it, is called Power, Privilege, and Oppression. And I was like, oh, it's the Tumblr class. Like, it's joking, but it really is, because they talk, that's all you talk about is, and it's uncomfortable as fuck.
Yep.
Like, it really is, and it's supposed to be, because you come in and it is a private school, so generally people are white. It's social work, so people tend to be female.
Yep. Same for
ages
marriage and
varying.
family therapy. Yep.
Yeah, ages are varying. Really, it's pretty cool. But they're like, the entire class, like, you focus on, you have to write this self-reflection paper before the second class, and it's like, okay, well, what are my biases? What are things that I need to work on?
Yep.
Which is really hard to write about. And then you choose one thing that you're going to research for the rest of the 9 weeks, because we're a quarter system too.
Yep.
And you're going to talk about it in front of a thankfully small group of people, but you're going to repeatedly talk about these things in front of other people who may even be that person that you're talking about.
Sure.
So you go in, you know, presentations, reading about microaggressions, which blew my mind. Like, I mean, the whole thing blew my mind. Like white privilege, all this stuff, and by the end of it, the intention is to come out aware of your own privileges and constantly trying to reassess them, because they force you to, because they bring that back into every single class. And then even in your final, like, capstone, there's a whole thing asking about that again. So, like we said, people can kind of just, yeah, sure, I'm going to say what I have to say to get out of here. Like,
which
to
is
get through it.
problematic in and of itself, but yeah.
Or like, yeah, sure, they just don't understand it, and it's usually a professor of color who the student's talking to about that.
Yeah.
Like, oh, they're just being defensive. It's like, I think you're missing the point.
Yeah.
Just saying.
Which, but, you know, the whole thing being, like, privilege is not a bad thing. So if anybody in chat's thinking, like, oh, well, like, is it, you know, why is it bad to have privilege? It's not a bad thing to have privilege. It's just something that you need to know and acknowledge. It's not something that's bad to have or inherently problematic. It's problematic if you don't acknowledge it and know it.
Right. And, like, realizing how you can, in a way, use that privilege to help other people who don't have that.
Correct.
But that class is intentionally first, and is intentionally part, like, they do a little mini version of it during orientation, because if you can't get through that, they don't want you in the program.
Right. And is there pretty strong gatekeeping around that in social work programs?
not as much as there should be. My school was really weird in that it like hammered it in, and like people, the class size, like I wouldn't say dropped in half, but a good amount of people dropped out after the first quarter, and you never saw them again. And like people have actually told the professor, "Oh, I don't want to deal with all this crap. I'm gonna go do psychology." Like,
you're gonna get it there too, just in a different dose.
Yeah, and especially at University of Denver, overall kind of tries to focus on that. But the social work school does it to a whole different level, and so yes, in our program, there's a lot of strong gatekeeping there. It's very intentional. So
I would argue.
I'm okay with
that
it.
should be, I would argue that should be the case. How hard is it to show compassion and empathy? It's kind of a general question, but I think it's an interesting one because we are subject to compassion fatigue in the mental health field. But I would love to actually hear what you have to say about that.
Part of it sometimes is, especially when you hear some stories and you're like, you're thinking to yourself, like, that's so full of shit, or that's horrible. Some of the things I heard people say is some of the most racist crap I've heard in my life, but you still have to be there for that person. And so in that situation, it's kind of, to a certain degree, fake it till you make it. And also trying to find that common relation of like, we're all human, we're all trying to do our best. Given what the person in the environment, like what did that person grow up with to make them, where they deal with to make them have that belief now. And trying to find that base connection with them is really the way I try to do it, to have empathy with people who I may not otherwise. But sometimes it's really hard, especially like personally for me, if I'm like having an off day or something, and it's just like I'm more focused on my own stuff than I am on other people's. It's hard, and that's when I really try to rely on just like, if someone's, especially on the high acuity unit, like screaming and throwing shit, like it's like, well, they're it's like put yourself in their shoes, but not too much. Like someone had asked a question about that, really like, is there not a risk of getting overly involved in your cases and seeing things that aren't there because of your own biases? Absolutely.
Yep.
Like,
and you
completely.
Learn and you're trained with how to handle that when it happens.
Yeah, and trying to be aware of like, okay, well how are your own experiences are going to influence how you see things, but at least be aware of it. And so
it's all awareness. It's what it's all about. Here's an interesting question from Tally. How can somebody who is from a privileged background truly understand the plights of less privileged people? I think their entire moral and entitlement baseline would be completely different. That's why it's important to listen. And it's being willing to hear, again, another person's experience and validate their experience rather than immediately negate it because maybe your own experience is different. So really making that effort to understand their experience.
Like from my own part of my own personal journey there, I don't want to say too much because my parents are home and I don't want to make them mad, but they're not the most open-minded people sometimes. We'll just say that.
Okay.
I'll just say that. So I did grow up in that sort of environment where it's like people are so respected, but it's like maybe you shouldn't say that. It's kind of not like my grandma's says them so. He was like, you can't say that out loud. Oh my god.
Yeah.
I'm sure a lot of people have grandparents like that. It's like, can't say that, pop.
Right.
Stop it. But like, it really is like you said, just listening to the person and believing, like, take what they say at face value is their experience, and your experience is valid, literally.
Yep.
Like if you're especially Black Lives Matter was a big thing when I started grad school, so we talked about that a lot, and as a white person, it was like, well, people love to go on that, well, blacks commit so many percentage of crime, but they're only so much percentage of the population. It's like, okay, but you're not looking at what that population has gone through historically to be in a more marginalized position to where crime is going to happen more because you're trying to make your basic ends meet, and all the governmental oppression that's still there. So there's so much to it that you just don't realize, and like listening to the stories that I either heard from colleagues slash classmates, to a lot of things that we read, because we had to bring in a lot of things. My teacher actually brought in a lot of people from different groups to come and talk to us, just to hear their experience and be like, damn, I like never even thought that would be a thing.
And just the power of different perspectives and different lived experiences.
Like, one thing that really hit me was hearing from someone about I forget if I think she identified as Black, but she was telling us about how, like, every kid, when they're growing up, they get that talk.
Yep.
And I was like, dude, it was, for me, it's just like, police are okay, maybe they're assholes, but, you know.
Oh, yeah, no, yeah, it was never.
But it wasn't like, and just hearing that repeatedly, that this is the thing that happens, I was like, holy fuck, that's, I swear like the sailor, that shouldn't have to happen.
It's fine, I do too.
That, like, to have to live with that sort of fear constantly, and it's transmitted every single generation for hundreds of years at this point in this country.
Yep.
Like, and to go, oh, well, everyone's lives matter. That's bullshit.
True also negates
yes.
what the message is. Because see, what I always loved is, like, all lives matter encompasses Black lives then. Because if you're saying all lives, you are including the lives of the people who are, I don't know, that's such a weird
how someone
response.
Phrased it to me was like, okay, well, if, you know, all lives matter, they do. It's like, if you're at a table as a kid and everyone's getting food except for you, and you say, hey, I'm hungry, and the person's like, we're all hungry.
right.
Yeah, but I'm not getting any food.
I don't have food, so...
Fuck?
That must be like a universal analogy that gets used with that, because I've heard that. That's always the analogy that I hear with that, and I think it's such a good one. But it's always funny to hear that when people say it. Absolutely. And by the way, like, as you're talking about this, I kind of want to emphasize, again, for all the people that are watching, like, when you are in the field of social work or really in therapy, the types of viewpoints that Victoria is sharing here, like, yes, we could say, like, okay, well, these are, like, very politicized viewpoints, which is true, but when you're in a social work field, like, these are the types of values that the field itself carries. And so to be part of the field means to align with those values and kind of live those out. So I want to emphasize that as we talk about it, because again, our work is political. It can't not be, and especially social workers. What was the most humbling experience that you have ever had?
I just remembered, like, I gave my most difficult experience and I didn't give my favorite one.
Oh yeah, that's fine. Go ahead. Feel free to do that now. If you'd like.
Gosh. I think that there's not like a single... Actually, no, it kind of just happened. Part of it came from my own lived experience, which I think we'll kind of get into later. But then also just the power of validating someone, where there's a patient who had been diagnosed, of course I can't say much more on this, but she had been diagnosed with dissociative identity disorder. And she had gone through so many therapists and people who didn't believe her. They're like, nah, you're full of shit, you're crazy, blah, blah, blah. And just giving her that space to be like, no, I hear you, like, and I believe you. And even if some of the things she may have said that she dealt with, because you don't get that from not dealing through trauma, that she had to go through, is like, I've heard that before. I just, like, saying I believe it, and the way she reacted just, like, was amazing. And just to see the power of, like, you know, it's that 70-80%, it's the therapeutic relationship. Like, I didn't even do anything but talk to the lady.
Yep.
And she had such a profound experience in that, and just, like, all the little things that come through that are like that are always really nice. I say it I'm trying to think in the field. I don't know if I've had one. It was really that class where it was, like, acknowledging the things that I have grown up with that just predispositioned me to have an easier life by the virtue of my family happens to come from Eastern and Western Europe. And that's the only reason. That was pretty, like, I almost wandered up out of the program because it was so hard to deal with. Like, I talked to my professor, I'm like, I want to do this, and she's like, think about it, think about why, and stuck through it. And I don't think anything could ever match up to that. There are constantly little things that happen over and over, that like, remind me of that, like when someone says, no, you don't understand. It's like, yeah, you're right, I don't. And just acknowledging that, and a little humbling there, but not quite as bad as
Sure.
It wasn't bad, but not quite to that extent as it was in the class.
But being able to say, even in that moment, though, like, you're right, I don't. And so, and then having the humility to be like, but I would like to understand. So, like, help me understand your experience, like that kind of thing. How do you manage, maybe we answered this already, but if you feel like you have, just tell me, but how do you manage with helping your clients, having a positive attitude for them when you're dealing with your own mental health issues?
Yeah, that one I was trying not to like answer until we got to here. That is, it gets easier for me. That is literally from the day I started the program been something I've had to work with and struggle with. I do see a therapist still, and I do have PTSD.
Okay.
So, it's much better. I am in a place where I can do this work. Like I've thought about it and made sure, like, am I okay? Am I able to keep my stuff separate from that person's? And done tons of work there. My therapist is also a social worker, so she helps me through that as well.
Cool.
On that level, part of it is honestly, I just try not to schedule work the day after I have therapy because I know it's usually really hard.
Usually a good idea, yeah.
God, normal like talk therapy is fine, but if we're doing EMDR that session, it's like, dude, I shouldn't go to work tomorrow.
Yeah.
Because I know I will be so just like dysregulated to where I'm like, I can't like be present with that person. And it's just being aware of what is my stuff and being aware of when it gets brought up. And then, part of what I did when I was in my internships is like, fortunately someone who was also a social worker did like way too much self-disclosure, so I had that model. But was self-disclosed too much, and it's like what I am constantly telling myself is like, okay, if you're gonna say this, why are you saying it?
Right.
Is it for your own benefit because you want to like get this out because you like talking to people, or are you doing this to help that person feel validated and that it'll help them?
Right. Who is this for?
Yeah, exactly. And it can be for both.
Sure, of course.
Like, if I come to work and I know I can be there, but it's just like I haven't slept well, or something happened the day before, is a lot of it is really through my wonderful, amazing therapist. She's fucking, I wish I could tell you her name because she's fucking awesome. But I've told her about your stream.
Oh, cool. Well, I appreciate you doing that.
She didn't know what I was talking about.
That's fine. A lot don't. But I mean, it's cool that first of all, I appreciate you sharing that because I think it's really cool of you to do that, and I'm sure it's vulnerable to do that. And like, we're people too. Like, therapists, social workers, we're people too. We have feelings. We are affected by things. And, what I'm hearing from you, which is what I would have said is just that, like, acknowledging if you're not in a great place can sometimes be half the battle, because then at least you're aware that maybe you're working on a 70% tank. And that's still okay. You can still be an effective therapist and be having a shitty day. I mean, but if you're ever overly affected to the point where it's going to do your clients a disservice, I know for me, since I have like clients who come to my office and pay and do that, like sometimes if I'm in a really horrible place, I might have to cancel sessions because I'm not going to be able to be present in the way that they're paying for me to be. And sometimes you have to work with people who are mandated to see you. And that's
sometimes
not quite the same. Well, all the time, very frequently, and that's a whole different dynamic.
Yeah. Part of like what that I constantly draw on regardless is that I can so easily see myself being in their place. I haven't been hospitalized before. I thankfully haven't had to deal with that. But I can totally imagine, like, and that's where I kind of got into trouble on the crisis line, is it was too close to home. And like I mentioned, that kind of alert thing of like, oh my God, what is going on? Would trigger the PTSD part of me that's like, shit! And then I couldn't think rationally about what was going on and use the things I'd learned.
Sure, yeah.
So that was interfering with people, and I'm like, I don't need to I'm just going to step out of this let's not do it. Even though I love it, let's not do it.
Totally fair.
Like, just with clients, you know, someone is screaming and throwing shit. Like, would I want to be here? No. Imagine being here with a bunch of other people who are like,
yeah.
You know, I do get to go home at the end of the day, and so
You're
you know,
right,
people
right.
screaming in the middle of the night, or you know, having your rights taken away for 72 hours. Someone mentioned that earlier. You know, like that would feel horrible. And when I do the groups, I try to lean into that.
Sure.
Without saying like, "Hey, I see a therapist too." Like, I don't say that at all. With other people, I'll say that, but like in that situation, like, no, I don't.
Right.
Draw that really hard line. I haven't even told coworkers.
Do you ever experience like, I don't want to say guilt, but like feeling unsettled by the fact that like there are, you know, you are working with people who are really struggling and might be inpatient or like are being held maybe against their will, and then you do get to, like, when you leave them, you do get to go home. Like, do you ever experience like feelings around that? And if so, like how were you taught to deal with that, or like how do you deal with that?
Yeah, I definitely every day experience that. Because the crisis line training I went through specifically was very, very, very. I agree with it more than I agree with the medical approach, but still not 100% of like, let people live their lives. We don't need to force them into treatment. We just need to give them space to fix their stuff, you know, stabilize them. You just talk to the person. That's the whole point of the crisis line, is talking to the person. Like, we tried so hard not to call welfare checks if possible, because that brought in another level of the police are there now, and the police are the law, and they can take your rights away if they want to for literally any reason. And then you get taken to the ER, and then you know, in the ER you're gonna be around a bunch of people who are there for like physical illness as well, so you're gonna get the nurse or the doctor who's had it, and they think you're wasting resources for being there. And I've heard stuff like, well, I've tried to save lives, now you're trying to take your own, like horrible things like that.
Yeah.
And then you're in this like you're just like completely gone because you're already stressed, because otherwise you wouldn't be here, but now you're in this situation where you don't want to be there, and now you're forced to be there. And we didn't want to do that, because then people could be discharged home. Colorado's unique in that, because we've had so many shootings, that we have a more developed crisis system besides hospitalization. Which that has definitely helped me in this job, understanding how that works. So, if we do have to call welfare check, then it's like, we absolutely have to, because we're still bound by law to not let that person kill themselves. Can't do that, regardless of what we feel about it.
Yep.
So going beyond that, it's like, as soon as you call the welfare check-in, then that's super hard to like undo anything, because it's completely out of our hands. It's into a completely different system. And then, I've read people's Colorado, we call it an M1. People call it Baker Act 5150. Reading the statement that says, so going to answer that question, at least in Colorado, like a licensed clinical social worker, licensed professional counselor, like fully licensed, who have taken another sort of class, physicians, peace officers, as they're put in law, they can assess someone to see if, one of three things, which you've said before, is a person in imminent danger to themselves, which that's the problem of imminent.
Yep.
How do you define that? And
Very difficult.
We still talk about that. Are you in imminent danger to someone else, which Colorado takes pretty fucking seriously?
Oh yeah.
And then, are you gravely disabled, which means you just, like, people who've come in who haven't showered for weeks. They haven't been eating right. They've been eating stuff that isn't food. Like, that, as well as when they can take someone's rights away for 72 hours. And after that, only a physician in Colorado can, quote unquote, certify you, which goes through the courts, where they take it to court, say this person still has not stabilized enough, they still need care. and they won't sign involuntarily. And if they say they will, I don't really believe them, because some people, yeah, sure, I'll stay, and then they don't.
Right.
And because it goes through the court, though, it will show up on criminal background checks.
Right.
For the rest of your life. So that I really struggle with at the hospital, and I understand why, for especially with people who have really severe psychosis. That, like, they really do need that help. Like Cindy said, though, they really need help. And so in that sense, I totally understand. Like, I sympathize with that. If I was, I've heard from enough people who come out of it, they're like, dude, I don't even know what the hell I was doing. Like,
right.
Someone who kept trying to call the doctor because they really, really, really needed to tattoo their feet. Read this online. And afterwards they're like, why was I trying to get my feet tattooed? Why did I think that was so important? And
right, it was like completely just disassociated.
Yeah. Or just like listening to people talk like, I'm gonna turn my fridge into a rainbow, or I'm Princess Diana's daughter, or someone who I know this isn't true, like suddenly now they've gone to law school, and I'm like, okay, interesting. I'm okay with that. I'm okay, not always, with the 72-hour hold if it's really, really needed for someone who's thinking of taking their life. Because if you put that distance there, it does help. Unfortunately, it also, if they call the crisis line and that happens, they're probably never going to call again. I've heard someone say that before. And I know because of their area code, they called where I worked. So I'm like, I know we really had to call it for you, but which unfortunately, now they're not going to use that resource again. But
unfortunately, that's where it's tough, because our hands are tied in that moment, because like I'm legally obligated. It's like I have to do my due diligence, and it sucks because it really is like it's a really giant gray area of
especially like
oh, go ahead.
Like you said, with like you personally think someone should be able to end their life if they want.
Yes.
But the law says you can't do that.
Correct. And 100% of the time, I am going to go with what the law and my code of ethics says, because it's not the Ryan show. When we're going through that, it's I have to do my due diligence. So that's where it's really important, I think, for people in our professions to recognize what your own biases are and whether they do or do not align. Which is why I think it's so cool that like you read the code of ethics to see that. Because then you know where you agree and where you don't, and you have to know what to do if you do or don't agree.
Yeah. And I see Ballistic's question. The one thing that I am really struggling with, and I talked with my therapist about this, and she's like, you might just never be okay with it, so I'm not, is when people are on court-ordered meds. I have a very, very difficult time. Like, emergency meds is one thing, we call them e-meds. Like, if someone is completely...
Yeah.
Like, we'll let people scream and shout and throw shit as long as they're not physically assaulting people. We don't care.
You're right.
But it's like, you know, someone put a patient put a staff worker in a chokehold. Yep. They got e-meds. Like, yeah, you don't do that because that's considered a chemical restraint. Don't want to do that. That sort of situation, I get it, because then it's like you're protecting others, people at a point. Or if, you know, I've seen someone who is just so completely gone that you're not going to get anywhere and they don't even know what's going on. And so you give them medicine just to bring them down to where you can talk to them and get them oriented to, like, anything, period. Like, literally anything. But then once the person's there, and if they're just, like, a little psychotic or they just kind of weird or whatever, forcing them to take medication, I, like, completely disagree with the doctors on that. I hate seeing that, and I hate that it's ordered. Because it's not illegal to see things that other people don't see or hear things that other people don't hear. But they're weird, and we want them to be normal.
Yep. Yeah, that's, I am with you in that.
Yeah, I hate every time the patients talk about that. Like, there's one especially who hates, like, I shouldn't have to take medicine, blah, blah, blah. And I'm like, the psychiatrist isn't there. So I'm like, yeah, I do. Like, that's also obviously a big difference between all the therapy mental health groups, counselors, social workers, LMFTs, everyone, versus psychiatrists. Is psychiatry inherently, they're doctors who specialize in mental health, pretty much. So they see it from that perspective of treating things with medication.
Yep.
That is biologically based and that you can deal with it that way.
Yep.
So if they do see someone who's having intense delusions or constantly talking to themselves, I say, so what? They're not alone. They don't feel alone. Cool. Yeah.
Right.
That's awesome. But the doctor sees there's something wrong, and so they have to medicate them.
Correct.
And because we're at a hospital and because
that framework.
Yeah, and because we're at a hospital, because we're insurance and all that, the psychiatrist is ultimately the decision maker.
Yep.
And hearing them say stuff, and hear one doctor at the hospital who I have just say horrible things about patients, and I'm just like, I just kind of want to smack her because she doesn't know anything about me. It's like, how can you just look at a person and think that?
You get pretty jaded when you get burnt out. I mean,
this person's very burnt out.
Yeah, I mean, burnout really is a really nasty thing in hospitals and mental health. I mean, all sorts of things. Because you say stuff that you wouldn't imagine you would have ever said once you start to burn out. It's really sad.
Yeah, and I really hope I never get to that place, because
What are they doing down there?
like the doctor said something like, "Oh, I was on the unit, that's essentially the suicide hold unit, for lack of better terms." And she's like, I was talking to someone and I told them they were malingering, and then they gave up and stopped complaining with and sat in the corner and just were quiet. And she was proud of that. And I'm like, do you realize what you just did to that person? You got them to shut up, but who knows what's going on now?
Right. Yeah. What's that? So I guess, that leads me to wonder, because, one of the things that I see a lot of people, or that I've seen questions about, of what's it like to be a social worker, or what do you do, that kind of thing. So you have to do a lot of coordination with doctors and with other mental health professionals and all that stuff. And I mean, what is that? That's something that I personally really do not like doing, and is part of why I stayed away from social work, because I do not like coordinated care and all that stuff. I get the need for it, but generally I don't like it. What is that like for you, and kind of what's your experience been like with that as a social worker? And I know we're talking about some of the not so great stuff that can happen sometimes with hearing other people's perspectives, but that's kind of my own question for you.
My internship was out of school, so that's inherently multidisciplinary, because you have a social worker, but then there's teachers and there's administration. And then at the hospital, the way our core team looks is the psychiatrist is the head, and then there's a nurse for the unit, and then they don't join the rounds, but there's a tech/mental health specialist, the people who are there constantly with the patients, taking care of things. And then the insurance people, utilization management review, who come in, and it can be very, very frustrating when someone else is trying to tell you how to do your job and they don't have the same background. So I will say utilization review, they're all therapists, so it's different in that respect, because they have that licensure and they understand. But the nurse, some of the things you hear the nurses say is just you can tell they're burnt out. The patient's not being manipulative. This has been very effective for them, and obviously it's still very effective because you're still doing it.
You're still, right.
And it's definitely is a challenge, because then you're trying to advocate for, for example, the psychiatrist may be more prone to breaking HIPAA and feel justified in doing so to contact other people to find out information. Whereas the social workers are very much not okay with that. Right. And they want, so what that you can't talk to the person, give them some time. And if the person that you want you to call, if they sign a release of information for John Smith, that doesn't mean you can talk to Jane Smith just because that's John Smith's wife.
Right.
But a lot of doctors think you can't.
Yep.
And so trying to,
We understand.
advocate for, kind of like lawyers do, advocate for your client's best interests.
Mm-hmm.
And communicate that in a way that learning how to communicate that in a way that other people will respect it is interesting, and it's really cool at the same time. It's also completely frustrating and maddening at the same time.
Sure, sure.
But I also like hearing their own perspectives on things as well, because obviously the nurses are around a lot. They have their own perspective of how taking medications and everything, and see things from more of like taking care version.
Mm-hmm.
And the doctors obviously see things from the medical view, and they interview the patients the most and see things that way. So everyone always has their own different view of what's going on, and they bring it to the table. And it ultimately, as much as it sucks and it isn't perfect and can cause problems, I think it's better than having just one person, like just a psychiatrist doing it,
Right.
or just a social worker doing it.
What are your thoughts on the potential job market and opportunities for social workers and therapists in the coming years?
I do know that social workers specifically, that has been like expected to grow for years and still is.
Mm-hmm.
Just because there is so many issues in society, and I don't see those ever going away unless, like, utopia literally. So in the way like society is changing to be more understanding of the social justice parts of it means that social workers are needed a little bit more.
Mm-hmm.
Also because social workers get burnt out, and the baby boomer generation's getting into retirement, so we need more people.
Mm-hmm.
I assume therapy as well probably isn't ever going to go away in general.
No,
because
would
people are
imagine
always
not.
going to have problems.
Yeah, and they're always going to want to have somebody who's unbiased to talk to. So I
Yeah.
know for a long time, for many, many years, marriage and family therapy has been one of the top 50 biggest growing fields, and we see that a lot. Like, people are just pumping out therapists right now. It would be nice if we could get therapists more distributed out of, I know cities need a lot of social workers and need a lot of therapists, but if we could get more access to mental health professionals in rural areas, that would be wonderful. I don't know where social work is with this, but I know that MFTs are starting to be able to do more online therapy and video sessions, and that insurance is starting to be okay with that. I don't know if social work has any of that going on right now, if that's becoming more of a thing or not.
Yeah, because I personally didn't like it. I've had a couple sessions, one with a different therapist, one with my current one, where we did the telehealth stuff through whatever the app is. It wasn't Zoom, it was something else.
Okay.
And I personally didn't like it because I like the in-person and it being in a different place. But I think social workers are kind of like, hell yes, because it's more, if we can't get out there, well, then we can meet you where you're comfortable.
Mm-hmm.
And just in general, in terms of getting out to rural areas, that's still a focus, because
Sure.
people naturally tend to gravitate towards cities because there's more to it. But then also, by the way, with the student loan forgiveness stuff,
Yeah.
if you live in a rural area, you're more likely to get it versus if you live in Chicago. If you get in Chicago, you're probably never going to get that. Sorry.
Oh, no, for sure. Had to resign
so
myself to that.
There are incentives to try to get people to go into the more uncomfortable areas, but like you said, social workers are still people, and so we're still kind of but I also want the best for my kids. And even though we realize that is in itself playing into the system we're supposed to be fighting against, it's well, shit.
Well, but that's the thing. We all have an agenda. It's not we all need our needs to be met. We all have, we all want some standard of living. And so it is. That's a hard space to walk in. And but yes, of course, you want to be able to make a living. It's same thing with a therapist. People say, oh, therapists, we charge so much money for our sessions, and after you account for insurance and all that other stuff, it's not as high as it appears in terms of our reimbursement and take home. So unless I'm seeing a full caseload of people who pay me $300 in cash every time,
right.
I'm not going to be making a massive income off of it. But quality of life is big. And as I know you guys all know, I took, like I say, I took a pay cut to be able to reconnect with why I'm a therapist in the first place, and just kind of how it goes sometimes. So.
And also kind of like what Cindy's talking about with insurance being a pain in the ass.
Yep.
It was so hard. You know, you work with someone who's like in San Diego, fine, you have all the resources in the world. There's like 20 MTFs in the area and bleh.
Yep.
And versus the, you know, someone who lives in bumfuck nowhere, Wyoming.
Yep.
It's like, oh, well, this doctor won't see me. Well, it's sure kind of shit out of luck because there's no one else.
Right. Like, what are you supposed to do then? Yep. Yeah, it's kind of a sad state of affairs as it relates to that stuff right now. And it's funny how, like, people, you know, I don't know, maybe you experience this, but, like, people think, like, oh, well, you know, therapists just want, like, yada yada because we want to be able to make more money. And it's kind of like, no, like, I want people to have access to me. Like, I don't want, it's not that I'm trying to, like, beef up my income and stuff. It's that I want people who need help to be able to get the help, like, to identify that they need the help and then me be available to them. It's not about me, like, generating an income. I mean, it is to some extent. I do need to make a living, but, like, we're generally thinking about clients, and you seem to be hinting at that when you were saying, like, you wish that there'd be a little bit more advocacy in terms of the association for clients.
Yeah. And I know if I've looked at the, like, our social work subreddit, and they're pretty much all like, bullshit. They all agree that they should, I mean, ultimately, they are advocating for people because you make, like, macro, which means, like, higher society, like, government, societal norms sort of thing. If you make those changes, they do eventually trickle down to make life better. I don't know if it's probably just because of social work that you're just sort of expected to, like, take a pay cut or not be paid well.
Oh yeah, that's like the whole adage is like, oh yeah, if you want to be overworked and underpaid, go to social work.
Yeah, and that's something we're trying to, like, also that the people would like an ASW to do more is, like, advocate for social workers as well. So,
because
like,
if you
we
do,
deserve
you're inadvertently
more pay.
advocating for clients.
Right, so we can do a better job at helping people. Like, I've never heard someone say, "Oh, a social worker makes too much money." Like,
no, I've never heard that.
And
yeah, those damn social work salaries.
And I'm in an interesting. It's really interesting for me too because, like, honestly, going to DU, it tends to be like upper middle class people, even like upper class, straight up. That I've never, like, I learned stuff because I went there for undergraduate as well. I learned stuff that I never knew about, and I never felt poor in my life. I went to that school, and I'm just gonna go skiing for the weekend. And I was like, what the fuck?
Yeah,
I can't even afford to go anywhere. I don't even have a car. To come in and people hear this thing, like, well, people are making, like, I'm not making very much, blah, 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 blah. But then I personally am making more money than I've ever made. And I think if I were working full time, I'm making more money than my parents make. So for me, it's quite an advancement because we weren't, like, I wouldn't consider us, like, poor. I never felt that way. And it was definitely, like, more middle class. But of course, middle class has changed since then. But I never felt that way. And it's like, wow, a lot of people must be coming from a higher point of privilege if they feel like $50,000 a year is a pay cut. To me, I'm like, dude, $50,000 a year, holy shit.
Yeah,
that's fantastic.
Yeah. I remember feeling the same way of, like, that's a lot of money. I can do a lot with that much money.
Yeah, but then also when you're making a lot more per hour, then all of a sudden you make a lot less when you're not there.
Right. Right. Oh my God, do I feel that hard right now?
I haven't worked, like, last couple weeks. I don't know if you saw, I only worked like 2 days out of the whole week, 2 weeks, and it was like, great. My paycheck, literally tomorrow's gonna be like $300. But even in itself, the fact that I got paid that much for working 2 days is pretty cool. But,
wait, okay, so I want to see, what did Cindy just say? So if you're charging $75 an hour and we make 10, how is that not taking advantage? So that's where insurance comes in, and where everybody having access to insurance makes a big difference, because If everybody has insurance that can offset the cost of that to where your copay becomes $5 and you can't afford that, or we're able to slide a scale because we are reimbursed through insurance in such a way that we can also kind of do what we need to do, like that's where that comes in. And so yes, like right now that's the tough space to be in, because we have to charge rates that people may not be able to afford, and so people end up getting turned down because of that. So
Right.
I mean, while I agree that like maybe we shouldn't have to have insurance, I think insurance, it does serve a purpose, right? Which is that it's being able to chip away at it so that if you do have something catastrophic that happens that does cost you a lot of money, all of a sudden you're not completely put out and bankrupted because you have the insurance for it. It's basically playing on people not having problems so that when you do have problems, you can pay for it. So that's the whole business model of insurance. If everybody's car broke down today, insurance companies would go completely bankrupt.
I think that's part of why when America tried to do the Affordable Care Act and they made it so you would get penalized for not having insurance, it's because that was trying to say we need everyone to pay to help make the system sustainable, which is, not like Europe and everyone else figured that out already. But,
Right. Well, I hope we get there at some point.
Yeah, and I want to, what Mealy Human said, I want to address that because I thought about it earlier.
Yeah, go for it.
Where he said, you usually see cases with intense intervention needs. Why do you think as a society we allow situations to get to that point before we seek out help to intervene? Like, part of social workers being therapists in a way like it wasn't intended.
Mm-hmm.
It just kind of, like, it was a natural fit eventually, and, like, we got into it, like, hey, we can take a different look at everything the person's going through to help them in that way. Like, hey, maybe if the person just had a different job, they wouldn't be thinking about killing themselves all the time.
Mm-hmm.
Versus maybe the person has, like, chronic depression or something. Not that there's anything wrong with that. Some people genuinely have that.
Sure.
Trust me. But social work really is supposed to be focusing more on the macro level to where we're supposed, like...
You're supposed to do more policy stuff.
I'm sure you heard the thing about, like, rescuing people there's like a boat crash or something, or a bridge crash, and you're rescuing people downriver to keep them from drowning.
Mm-hmm.
Or you're like, why don't we go upriver and stop people from getting in here to begin with?
Yep.
Because it's less work and you have less work. There's less to it, it feels like, and you have a greater effect. So we're supposed to be doing policy, trying to make those changes, advocating at the state capitol, doing things like that, so that way it will trickle down, unlike trickle down economics.
With the metaphor, it's like, well, for me to get upriver, I need a car. So can I get the resources I need to get upriver so I can do what I need to do?
We're supposed to, quote unquote, be doing more of the macro stuff, and a lot of people do tend to go, I actually don't want to do this. I feel like I'm not making a change. I want to, like, one of my classmates works for this government, is like a utilization review type person for Colorado Medicaid.
Mm-hmm.
And so she has a very different, like, it affects a lot more people, and can make, she goes up through that, can make a lot more changes at once, and try to put us out of a job in a way. But I came at it from, like, a different background, because I did international studies, which is very, very, very macro, literally.
Oh yeah, doesn't get much more macro than that.
Like, one class I took was like on international law, and I thought that was awesome. And like, I was like, I want to, like, I could do that, but I want to, like, work with people. So I went the opposite way, as like people who did psychology want to do more macro stuff. Because they're sick of people. Which is funny. But a lot of social workers also will feel like they're not able to do enough, and there is a joint MSW-JD program and become lawyers and make changes that way.
Yep.
And I've even thought about doing that, but I'm like, hey, I'm just gonna wait.
I thought about that too. It would be super useful. It would be super useful to have a JD along with everything, but I do not want to go back to school. I'm done with school.
said, so it's more of a real world application with your job. You have to investigate the person's lives as a whole. I'm trying to relate that back to the other question to make sure, but tell me if I don't answer this right. But yeah, we're trying to look at like doing the therapist model. Someone comes in and like, I'll take me as an example, actually from a few years ago, quite a few years ago. Come in, it's like, you know, saying like, I want to kill myself. Mm-hmm. Okay, cool. Why? And you know, a psychiatrist might like do the Beck depression scale or whatever the hell it's called.
Yep.
And you know, okay, well here, take Prozac 20 milligrams a day, and I'll see you in a week. You know.
Yeah. Yeah.
Sure, that is gonna, and that is part of what social workers look at. Is like, is there a medical part of it? That's part of differential diagnosis. Is like, is it a medical thing first?
Right.
Because that's totally something we can do. And certainly there are definitely, absolutely stuff that comes from within, like however, you know, brain chemicals work or whatever, and genetics and all that definitely plays a role. But if you just look at the person that way, when you broaden it out a little bit to be, well, how's it going with their family? Or how's it going with their boyfriend?
Yeah, which is
and
where
look at
we
that
go.
system.
Yep.
Yeah, which is where you guys are.
That's where we
and
go.
you're so good at it. I took a family therapy class and I was like, bro, fuck this.
Yeah, there's a lot there. Yep. Yep.
And then, not that I didn't like it, but I was just like, this is so much, so many people.
No, that's totally fair. I mean, that's why I say it when people are like, how do I decide what degree I want? Like, you got to know what modality you want to be with. You got to know if you want multiple people in the room or not. And having multiple people in the room is a lot of work.
Oh, yeah. I literally don't think I ever, because we did like role plays in the one room that like it's literally got one-way glass, so it looks like a therapy office. Mm-hmm. And I like don't think I ever actually was the therapist. I always played like a teenager or a kid or something.
That's yep.
But the professor was amazing. He's still, I like want to keep in touch with him because he was really cool. And with, so you're gonna look at like the family relationships that way. And then, you know, a psychologist as well, they're going to look more at, like, the battery of tests. What can we run you through? Is there, like, an intellectual disability there or something?
Yeah,
or learning
more of the
disability that's
brain
causing your
stuff.
depression?
Yep.
And then, I guess, disclaimer, all therapists look at this to some degree. It's not like no one ever looks at anything else.
Right.
Social work will try to look a little bit more like the psychosocial assessment I do. And, you know, I'll just like in my mind try to run through everything, and so there's like, what brought you in? Have you had any treatment before? Where did this start? Do you have any legal problems? This is where it goes off topic a little bit. Tell me, like, do you have any significant other? What are their names? How old are they? How are your relationship with them? Yep. And I always give people the option to opt out of this because I have my own lived experience. I would fucking hate to have to say this over and over and over again. I would want to do it.
Yeah.
I sound young? Guess how old I am. I want to see. Because that's sort of the trauma-informed thing that I personally really care about a lot. Is I don't want to force this person to have to answer things again. So if they say no, fuck it. I'm like, cool. Less paperwork for me.
Let's move on. Yeah, right.
But also I want to respect that for them. So if they're willing to, going through, you know, finding out their family, their parents, did their parents have substance use problems? Did someone in their family die from suicide? Was there abuse that they grew up with? Shut up, Polar. I know him. I'm not just bullying a random man.
Oh, all right. Like,
I'm not just bullying a random person in chat.
Oh, okay.
To like go through the whole family, and I think it's like, okay, well, what's your educational background? What's your highest level of education? When you went to school, did you like school? Did you like drop out a lot? Did you have horrible attendance? Which again has its own reasons why.
Yep.
Just to kind of see how you grew up. And then you go into like, okay, well, what substances do you use? How long have you used them? Like being totally honest. Like, dude, I don't care.
Right. Like I just need to know. I need to know because.
Yeah. It's really important, especially when
very important. Yep.
With then it goes into like, well, what are other things that maybe you're addicted to, like video games?
Yep.
That's actually a specific question we ask. It's like, do you use electronic devices? Everyone does.
Yep.
Or play video games. If you do, how much do you use it per month or per day? Do you feel like it's an issue?
And so you have them self-report of whether they feel like it's an issue?
Yeah, is it causing disturbance in your life?
Okay.
Okay. If they feel like it's not, then cool. I'm not gonna try and deal with it if it's a support for you, but if it's really destroying their life, then that's it, you know.
Yeah, sure.
But if they don't care, then well, I guess I don't care. And like, what else? Then there is a section on trauma history, and almost everyone skips that with me because I'm like, okay. I always try to go through the person's chart beforehand to find out as much as I can, because
Sure.
I saw someone ask a patient something they'd been asked 5 times and it didn't go so well.
No,
why.
they get really annoyed. Yeah, I can't say I blame
I
them.
get pissed off. And like, okay, we're not going into therapy here. I have a therapy, but we're not gonna. You have every right to say no.
Yep.
And this part's called the trauma history section, and we're not gonna get into it because I don't want to open all that up. What it is asking kind of a yes or no. Do you want to talk about it first off? Yes or no? Cool. Yes, they do. Some people don't care because they don't have any issues with it. And it's like, okay, and if you do, I'm going to go through and say, have you experienced something in this category? And just say yes or no.
Mm-hmm.
And if you want to give, I pretty much just say, don't tell me about it, because if I even give like a little leeway, I know it will go into more.
Mm-hmm.
Like, well, tell me about the child that you had dealt with abuse. What does that mean? Like, even so much as going into, I don't want to trigger anything that I'm not equipped to handle, because obviously the trauma thing, that's like a barrier that is very, very thin for me that I don't want to get too close to that.
Sure.
Because then it'll trigger my shit, and then we're all going to be a mess, and then it's not going to good. That's not ethical, and I can't do that.
Sure, totally fair.
And it's like, tell me, have you dealt with abuse? Yes or no? Cool. Have you dealt with domestic violence? Yes or no? Cool. And just like limiting it to that. And I know I've seen other people go like, have you dealt with this? Yes? No? Okay. And then they don't seem to care.
Mm-hmm.
About the question. It's like, I know that is a really heavy thing to ask, and like, I know, like, I like to think that hopefully my patients appreciate that I work with, but
yeah,
it's part of it is also because I'm like, I don't want to talk about this because I asked like just a little bit once, and like the person just kept talking.
Yeah,
and it got out of hand. Like, not that I couldn't bring them back down, but it was like, just from like the basic validating, wow, you're a really strong person, you've dealt with all of this, and you're still here, and you're still trying to make changes.
Yeah.
You know, but it's like, dude, I can barely bring myself back down. How can I be expected to help someone else do this?
Almost time for me to wrap up, so I want to give you a chance really quick, Victoria, if there's anything you haven't said or anything that you think is important for everybody to know about social work, crisis intervention, whatever it might be that you want to say before we wrap up.
Apparently I don't even know how old I am, because I said I was 29. I'm 28.
Well, let's do 28 and a half.
Someone mentioned earlier, isn't using the historic memories, for want of a better term, an excuse for current crimes as a cop-out, though. There's so many people who have got out of the situations they're in by pure hard work, and that do they not use history to perpetuate gang culture? Again, devil's advocate here, and this person identified as black, so that's fine. That certainly, like, I'm not saying that doesn't happen, because it certainly can. Like, oh, well, this is what I'm expected to be, so, oh no! You know, just kind of, quote-unquote, using it as an excuse, but I think a big part of it is that it is so ingrained, like, especially racism in the United States. It is so ingrained that, like, you look at it and see gang culture, but, like, where did that come from? And how did oppression form that? So even if it is kind of an excuse, it still caused it.
Sure,
so
sure.
I don't feel
it's still a contribution.
Someone earlier had asked, what is my view on assisted suicide? And that is something we, first thing in our class was to talk about our own views on it, because you need to know your own shit.
So they actually had the conversations about that in class?
Yeah, we had to write a paper and then we talked about it in class.
Okay.
All the time. And I will say that this is me being a little vulnerable because I know some people won't agree, and I realize this is just how I would feel for myself. That if me, not anyone else, were in like some situation where I had a horrible disease, I personally would still want to hold out hope that something might change, that there may be something that could happen.
Okay.
That maybe something could get better, or
Sure.
I've seen enough times where doctors say, oh, you're gone in 12, you have like 3 months to live, and the person lives for years afterwards and lives a decent life. But that is my view on it, and is formed from different things.
Sure.
So I totally, like, when people then, again, say someone, I think it was the person who asked the question, said, like, I'm going to eventually have this disease and I don't want to deal with it. Like, I would feel, especially as a social worker, coming in and saying, like, no, you have to stay here, which is, again, linked to just suicide in general.
Right.
Is like, man, that's shitty.
Yeah.
And so when people think that stuff, that's another thing. Like, when you're working with a client who thinks things very differently than you, is like respecting that and validating that, while you're at the same point, you still think they're completely wrong.
Sure. And understanding just where that comes from.
Yeah. So that's my view on that. It's very difficult, and still something. There's a lot of stuff that I still struggle with. Like, why am my current thing is the court mandated meds. I still hate. I use every chance I had to say how much I hate seeing that.
Yeah.
And I think that's what it's supposed to be, because I read something, because social workers too have to do CEUs to be licensed.
Yep, as do we.
I have a full license. I am a licensed social worker. I am not a licensed clinical social worker, so I can't do therapy on my own. But I have taken an exam. I have a license. I took the clinical exam, though, so technically I could. I just have to get my hours in.
Well, I want to say thank you for your willingness to come on and do this interview and be the first, like, mental health interview of Stream 2.0.
Yeah.
And it was really cool of you to do. I really enjoyed this. I hope you enjoyed it too.
Yeah.
And
I did. It was really fun.
We'll probably have to do a part 2 at some point, because I know there's more questions that we couldn't quite get to, and that's totally okay.
Yeah.
Not only is she a fabulous mod, willing to talk about what she does as a social worker, and really, I really do appreciate that.